Well, running season is right around the corner. In fact, some people are already hitting the pavement, getting ready for the run walks that are planned for our area.
So are you ready? And Health Watch, Shelley Botat has advice from an expert so you can make it to the finish line without injuries.
Are you signed up for any 5 or 10K runs, or perhaps you're thinking about tackling a marathon? Whichever length of race you want to run, you need to start training beforehand to make sure you don't injure yourself.
Joe Woldt is a physical therapist at Aurora BayCare Orthopedic and Sports Medicine Center, so he knows how important it is to train before tackling a 5K or longer run.
With runners, it's mostly repetitive injuries. Commonly see people with anterior knee pain. We also see a lot of hip pain and plantar fasciitis or Achilles tendon problems.
If you've never run before, don't set your sights too high.
Starting at that shorter distance is key, so maybe like a 5K to start with, build up to a 10K, then the half marathon.
If you're a runner but haven't been working out over the winter months, you should ease into a new program.
Generally speaking, we kind of recommend like a 10% rule. Like you don't want to increase activity more than 10% at a time. If you're doing that when you have a huge increase in activity, you could have a higher risk of injury.
If you've been using the treadmill during winter, you should still take steps to transition from running inside to outside.
When you're running on a treadmill, the motor is actually doing a lot of movement for you, so your muscles aren't quite working the same. So a lot of times I'll recommend that patients kind of stagger running outside with a treadmill run. Like Monday you do a treadmill run, Tuesday you run outside to kind of ease back into that transition.
If you're not sure how much you should exert yourself, Aurora BayCare Sports Medicine offers a running analysis program.
We'll kind of look at the running mechanics and say, hey, this could set you up for injury, this could make you a more effective runner, and kind of give recommendations there. We'll give them some exercises to help improve their running and kind of reduce that risk for injury.
So you can hit the trail with confidence.
If you do start feeling pain during or after a training session, Joe says you should absolutely not work through it. You should take time off. And if the pain doesn't go away in a week or two, go see a physical therapist or athletic trainer. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Botat, Local 5 News.